Okay, so now we're recording. So welcome to the Female Hormone Workshop. I'm Kate Godley. I'm a physician assistant and owner of the Functional Medicine Center. And with me is Rachel Zingone, and she's a clinical herbalist and is at the Wellness Station. I always want to use the wrong name. So we are here tonight to talk about hormones, and we wanted to get started by giving you a little overview. I treat women of all ages. Oh, it's not letting me minimize. Hold on one sec. I treat women of all ages who are having PMS. I've had patients as young as 11 or 12 in here. And then also women that are phasing off of some of their hormone treatment as they are 10 years past menopause. So that's kind of the range of the ages I see. And I do use bioidentical hormones sometimes, but I will say most people that walk in and ask for bioidentical hormones, usually we can do a lot of other things before we get there. And I think that will make more sense as we go through our workshop today. So we're going to touch on PMS, we're going to touch on the normal cycle, we're going to touch on menopause and PCOS, and Rachel's going to tell us about some of the amazing herbs that can help our hormones function like they should. Anything to add, Rachel, while I open my document here?
Well, no, there's a lot of ways in which herbs can really be supportive to both help with symptoms and help with deeper patterns of imbalance. And oftentimes they can really prevent people from having to do bioidentical hormones and have a more natural and easier solution with less side effects.
Yeah, well said. So I think sometimes it's easy to start on hormones, but they're not without side effects. And of course, a lot of times if you take the more natural approach, the benefits are more than just fixing your hormones. There's so many benefits, right? So I'm going to share my screen. So just let me know that you can see, and I can email out my PDF at the end. We're going to try to wrap up around 6:50, so we have time for questions. If you guys have questions and you want to jot them down, you can. You can also find the chat box on the lower right, and you can type them in and we'll look at them at the end just so you don't forget your questions. Okay. And I'm assuming Katie can hear us. I haven't gotten a message from her that she can't hear us. So Katie, my work number is 919-578-2323. Feel free to call if you can't hear us. Okay, so can you guys see my screen right now?
Mm-hmm.
Okay, great. So some of it might be a little blurry, but I can send these out for you. So the first thing I just wanted to address is that when people talk about their cycle, it's not as straightforward as, well, here's when my progesterone should be highest, or which would be this red here, or here's when my LH should be highest. It's actually all four hormones working in harmony. And as you can tell, this is kind of a complicated graph in terms of if one thing is off, you can feel symptoms. So something I want to point out that a lot of people don't realize is that day one would be the first day of your period. And so even if that's just like a light spotting, it's still day one. And most people ovulate mid-cycle, and that's what we want. A lot of people are seeking fertility treatment these days, and a lot of times that's either because they're not ovulating or they're ovulating at totally unpredictable times during the cycle. So if you're not taking birth control pills or using something like a progesterone IUD, then you should be ovulating somewhere mid-cycle. I think it's, shocking that so many women actually don't really understand how all this works. And so I try to take time to talk about it a lot. I was one of those kids that was really into science, and I asked a million questions about all these hormones way before I got my period. So I was obsessed with learning about how the body temperature goes up, but I realized everyone is not like that. So as I go through, definitely jot down if you have questions. So one thing I just wanted to mention, and I took some screenshots from this really helpful textbook that I cited at the end, but basically when we check our temperature, which this is your basal body temperature. So when you first wake up in the morning, before you move, if you check your temperature by mouth or under your armpit, we're not talking about checking vaginal temperature, but if you check your temperature and you see it go up, then you can predict when you're ovulating. So for some people, this is helpful because it helps them get pregnant. For some people, it helps them prevent pregnancy. Other people, they're not using it for either one, but it is kind of nice just to get to know your body. So I think it's certainly interesting. And the other thing is that there is a low point in your basal body temperature right before this luteinizing hormone surge. So let me back up for a minute and just point out that the orange is called luteinizing hormone. The green is estradiol, which we typically say estrogen. Progesterone is red, and follicle stimulating hormone is, I guess, that purple color. So you can see that the luteinizing hormone goes up. This is the drop in the body temperature, and then around ovulation is the increase in the body temperature. I recommend that if people want to try to use checking body temperature as a form of birth control, that they need a natural family planning coach. These people exist basically to teach you how to check this temperature. There's plenty of apps that will help, but nothing can really replace a coach whose only job it is to basically teach you how to do all these things. Besides checking temperature, you can also track your cervical position and the type of cervical mucus and other signs like breast tenderness or not moodiness, but more like libido. That can also be a sign that you're ovulating. So a natural family planning coach can be helpful. Years ago, I never thought I would be recommending that to people, but I see so many people that cannot tolerate hormonal birth control these days that it really is another option to think about. I also just wanted to mention here that sometimes during the cycle, people have what's called estrogen dominance, and they often gain weight around the middle. They have anxiety, insomnia, racing thoughts, or exercise intolerance. You don't have to have all of those. And this can also look like cortisol excess. And cortisol is coming from the adrenal glands, not coming from the ovaries. And we're going to get to that. And Rachel's also going to touch on this later. But I just wanted to mention that sometimes when people come into the office, based on the history they're giving me, I can't necessarily tell them exactly what's going on until I order their labs and get a blood level of their hormones. And if you're not taking any hormones, getting a blood level is very accurate. If you're taking creams that contain hormones, then we really should do the saliva testing. The other thing is that I can often check liver enzymes, reverse T3, which is part of the thyroid panel, a full thyroid panel, and fractionated estrogens. And this can tell me if a patient's liver needs work. Rachel, did you want to talk now about kind of the liver herbs and how that relates, or do you want to do that at the end?
Yeah, I can step in and talk about that. So liver herbs can be really helpful when we're talking about hormones because they can clear hormones that need to move through the body and just general toxins. So if your liver is stagnant, as we say, and it's loaded, then it's not functioning as properly, and then your hormones aren't being processed through your body. So that can really lead to estrogen excess, let's say, or just other imbalances. So and that's just speaking about from a hormonal perspective. There's a lot of other ways in which liver herbs can help support the rest of the bodily systems. Mm-hmm. So some ones that people are probably familiar with, milk thistle, that's one that people really hear about for the liver. That's not actually one that I recommend that often. That's more for, I use that more for like more significant liver damage. When we're just talking about giving the liver some support, cleansing it out, I really love dandelion root. It's really gentle but also effective. Turmeric is also great. So if someone was having inflammation, having some pain, then turmeric, people know about that as an anti-inflammatory, but it's also really great for cleansing and supporting the liver. So we like to pick herbs that have dual purposes that are tailored to each specific person. Artichoke is another one. It's very bitter. That can be good when there's fatty liver. So, depending on if Kate does liver work and if she can see that, what's high, is going on with the liver, then we can tailor the herbs to that particular need. Burdock is also a good liver herb. So if someone had skin issues, that would be a good one. But the point is that when you're working on the liver, we're going to clear out the hormones, we're going to remove the toxins, and we're just going to get things really clear up the stagnation, get things moving. So definitely liver herbs are something that most people could benefit from, even if their liver panel looks fine. It's still a good adjunct, especially if you suffer from PMS or in menopause, or if you're having any kind of symptoms that are uncomfortable. Generally, working on the liver is going to be beneficial for helping with that and helping to address the deeper problem. That's one piece of the picture there.
Yeah, that's great. And one thing I often say to people about the liver is every month we've got to get rid of the hormones that we use that are no longer needed and they've been conjugated, and we've got to get rid of them. And then how do we do that? We filter them out of the bloodstream through the liver, and then they're in the bile, they're sent into the stool. Obviously, something like being constipated is going to back up this whole system, and of course, having liver issues. And sadly, liver issues and being constipated is very common. Those are both very common in our society, in our American diet. So
definitely. And the yellow dock is another one that's really helpful with constipation, and it's a liver support. So oftentimes we'll do a formula with a lot of different liver herbs, but they have specifying secondary actions.
Yeah, that's awesome. The next thing I wanted to mention is just that progesterone deficiency. Sometimes people say, I can't sleep. And that makes me think, I wonder if they have enough progesterone, because progesterone can make us sleepy. And sometimes their progesterone is actually at a good level, but the problem is their estrogen has gone up too high, and we actually need them to be balanced. So you may not have low progesterone, even if you have all the signs of low progesterone. It may simply be that your estrogen's too high. Another example would be low testosterone. Here I just put low T. And, we talk about this a lot with men, and we don't talk about it enough with women. But many women with ADHD or low motivation actually really do have low testosterone. I've been seeing that more and more lately. I don't know if it's worse seasonally, but definitely have a few women, late 40s, early 50s, that didn't realize how long their testosterone has been really low. Of course, it can affect libido too, which we'll talk about in a minute. But I just wanted to point out that women need testosterone, not as much as men, but they need it. And of course, everyone needs the progesterone and the estrogen until menopause, at which point I'm going to show you a graph in a minute of what happens.
And testosterone is the building block for estradiol. So it's, the hormones, they're interacting all the time. So it's very hard to isolate one, like Kate was saying. They're all so interconnected. So it's not just as simple as like, oh, I have a progesterone deficiency. You can have testosterone affecting your estrogen, and everything is really interrelated. So it can be kind of complex to assess.
Yeah, and I've seen a few people that switched really quickly, almost because they are converting, like suddenly they're converting the testosterone to more estrogen really, in a matter of 3 months, they've changed what the issue is. And you can find a lot of these things over the counter, not testosterone, but you can find progesterone over the counter. A lot of the herbs Rachel mentioned you can find, but I don't recommend people just kind of willy-nilly start taking them, because if you don't have levels for a baseline perspective, or you're not working with someone, it can get all muddled because they interact so much. Even if you're just a practitioner yourself, it's still actually hard to stay objective and look at the whole picture. Okay, I already mentioned that day 1 was the first day of your period. Some women say this day is lighter than day 2, and day 2 and 3 may be heavier. Some people have very heavy periods. Now, very heavy typically means like it would be more than 1 pad or tampon an hour. Some people tell me it doesn't seem that heavy, but then they start to have clots. So even if like the liquid part coming out is not that much in quantity, they're having clots, and that's concerning. commonly I see that when progesterone is low, but that's not the only case, right? There are times when people have gotten to the emergency room because they had such heavy periods and they've actually just gotten a shot of progesterone. And believe it or not, if their progesterone wasn't low to start with, that's actually not a great treatment. But if you go to the ER, they're going to do something quick to try to help you. So my advice would just be try to get help before it gets to that point where you actually have to go to the ER because it's so bad. Then I wanted to mention, yeah, go ahead.
There is a really great formula by Vitenica called Slow Flow, and that has a wonderful bunch of herbs that can help to slow down excessive bleeding. So if that is something that if someone struggles with flooding, or every month you're bleeding to the point of nearly passing out, and you need something to help you, that's a really great one. And while it's not addressing the deeper imbalances, it's helping in that moment, like symptomatically.
Yeah.
So Vitanica Slow Flow is really fantastic for that.
Yeah, we've got that in the closet. And how often, Rachel, do you feel like you see people that have like that random heavy period, but then everything kind of seems to go away because they just had an intense period of stress?
Totally. The stress can have a huge impact on even just one cycle. So you can look at that if you're having a cycle that's more like a period that's more difficult than normal, with heavy bleeding or more cramping or just feeling more fatigued. Look at what's been happening in the past month. Look at your stress levels. And the stress levels, they affect the hormones. So if things are really rough in your life for a certain period, it's not unexpected that it could manifest in how your period is.
Yeah, I have a good friend that's an accountant. So guess what time of year she calls me with a heavy period? Right? Okay, so luteal phase defect. The second half of the cycle can be too long or too short. So I just wanted to bring this up because if I go back up to our graph, a lot of people call this second phase from ovulation to the period the luteal phase. So I just wanted to point out that's what that term means. And acupuncturists or Chinese medicine doctors will often talk about luteal phase defects. Anyone working with fertility talks about this because this is more commonly where people have issues if they're having trouble getting pregnant. Anything to add to that, Rachel?
No.
I think we already talked about how do you know when you're ovulating. If you haven't kind of tried to guess, see if you can figure it out because it's just a good way to get to know yourself. After ovulation up until you get your period, so around day 14 until your period, you do need more protein, more carbs, and more salts to stay hydrated. And by salts, I don't just mean sodium, I mean potassium and magnesium. And a lot of women need a lot more potassium and magnesium than they think they need. So if you have time, look up Stacy Sims and just Google "women are not small men." She's actually an exercise physiologist who specializes in women that compete in triathletes. And she's great at explaining all this. And I love how she explains like why women should not be fasting from ovulation to period. And of course, with intermittent fasting being so common these days, it's something that I talk to people about a lot too. And along the same lines, I wanted to mention, why do you crave chocolate? I remember reading years ago that we crave chocolate more for the magnesium, sometimes the zinc and the iron. And that kind of opened, I always crave chocolate a lot, but once I read that, I realized there's other things I could reach for that would actually kind of better meet those needs. And I could stick to my chocolate, 1 square a day is fine, but when your period's coming, if you're eating bars and bars and bars of chocolate, there's a lot of other side effects that you might not want. And I just mentioned the theobromine is a vasodilator. So some people actually get like red in the face when they eat too much chocolate. Some people think they're allergic to it, but it's really just that theobromine. But my point was, yes, a little bit of dark chocolate in moderation is not going to be the worst thing. But if you feel like you're craving candy and it's chocolate, then it could be other things that you're missing from your diet.
Magnesium is the number one mineral deficiency. So that is something that probably most people could benefit from taking, especially women. So that's magnesium is really important.
Yeah, we need magnesium for a lot of things, but one of them is actually to process our vitamin D. So even if you're in the sun and you might need more magnesium that night, and our fruits and vegetables in the last 50 years, they've lost like a third of their magnesium content because our soil's been totally depleted. So I think almost everybody needs to take magnesium, unfortunately, because it would be great to just get it from food. But the other thing is I mentioned the B2 because recently I've been checking more and more people's B2 level. It's just been on my radar. And if you get PMS related headaches, there's quite a few papers that say taking B2 and magnesium together before it becomes a migraine, when it's still just kind of a headache, can really curb the headache. And these recommendations are daily doses, but again, I wouldn't recommend taking this until you talk to your provider. Anything to add to the headaches, PMS related headaches?
Let's see here. Well, no.
We'll come back to that. Yeah, I think I know what you were going to say. So, I wanted to talk about hypothalamus pituitary axis, and I don't want to lose anybody with all this biochem, but the hypothalamus and the pituitary are located in the brain, and the anterior pituitary is where most of the signaling of our hormones comes from. And what happens if you go see kind of like in a very busy clinic, sort of a traditional GYN, they will sometimes just talk about your ovaries, but everything's in a feedback loop. And so the point of why I put this up was I wanted to show you that your ovaries produce estrogen, and in the beginning of your cycle, this is actually telling the hypothalamus to turn off the signal of something called GnRH. Don't worry about what this is. Just know that the estrogen is turning this off. It's also turning off the production of FSH and LH. However, mid-cycle, that totally switches. So the same hormone is actually signaling something different. And I find that kind of fascinating because the body knows how to change these things. But certainly issues with the hypothalamus or issues with the pituitary are going to totally throw off the ovaries. And similarly, the thyroid and the adrenal glands, and we'll get to that in a minute. But I also wanted to note that later on in the cycle, in the luteal phase, the progesterone is what's turning this off. And we've already kind of mentioned this, but a very common issue with the luteal phase is that people don't have enough progesterone. And I know because they tell me they have insomnia. And really, you should be sleepier before your period. You shouldn't be wide awake. You should actually feel like you need more sleep before your period. So I hope that kind of helps everyone appreciate how complicated this can be, but also the fact that these hormones are these tiny little molecules that go to every cell in the body, and they do cross the blood-brain barrier, so they go into the brain. So yeah, PMS can be real, right? And then I just kind of wanted to move on and talk more about menopause. So Christiane Northrup's book, I know it's really long, but if you can sort of take some time to go through it at your own pace, she talks a lot about what's supposed to happen. And I love that she talks about how the energy chakras in the body can affect the organs, the pelvic organs especially, and that our ovaries and our uterus are a creative center. So if you're feeling really stifled creatively, if you hate your job, it's very likely that you're going to get something like fibroids. And she sees that all the time. And she's an MD who's just noticing this for many years and finally started to do more research. And, now for 20 years, she's been writing books about it. But she also has a book just about menopause. The book that I recommended people get before this is called Women's Bodies, Women's Wisdom, but it is very long. But the other thing is I heard an interview with her years ago, and she actually talked about doing more selfish things. And she means that in a good way, right? Like she's saying, as you go into menopause, your estrogen slows down, your estrogen levels go down. So her point is now is the time when you're going to start thinking about yourself again. So if you did take time to have kids, you're now kind of back on track with what you want for your life. And this is supposed to be this way from sort of a evolutionary aspect, if you will. But I also love Wanda Sykes. She has an awesome kind of comedy routine where she talks about menopause, and she actually had hormone receptive breast cancer, and so she cannot take bioidentical hormones, and she jokes that people ask her if it would kill her to become more ladylike, and she says actually yes it would kill me because she can't take estrogen. So if you have time, take a look at her Netflix, because she just says I'm just becoming a man and I'm not going to apologize for it. It's something to embrace. So I think it helps, though, sometimes going through menopause if you just know what's happening. One thing is that the estrogen goes down, I already mentioned. Fertility goes down, but then these hot flashes come up. Sometimes people have dryness of the vagina. Sometimes people also have psychological symptoms. Kind of the psychological symptoms are often worse before the period actually stops. Many people come in and say they haven't had a period in a year. They're sure that they're in menopause. And for whatever reason, I think because of our current level of pollution and kind of our food sources being polluted and our foods being processed, their period does come back. So it's not always as straightforward as this. I also see people go into menopause a lot earlier than they should be. And that can simply be stress and lack of sleep also. If you think about it, you continuing to get your period is also your body's way of saying you're healthy enough to have a child. And so you can go into menopause earlier if your body is not healthy enough. Having said that, I've also seen people make big changes quickly and then fix this. Now, why would you want, if your period's going away, why would you want it to come back? Especially if you're someone who really hates having your period. And the two main reasons are your bone strength and to protect your heart. So estrogen keeps your bones strong and it also protects your heart. And if you notice here, osteoporosis goes up after your last period ends. There's plenty of ways to prevent that. But if you're someone who's already got osteoporosis before menopause starts, you are someone especially that I would talk to about doing the bioidentical estrogen.
And I'll just
Yeah.
say that, herbal calcium and mineral vinegar can be really, really helpful. And there's a lot of herbs that are high in calcium and magnesium and potassium and a lot of the minerals that we need. Raspberry leaf, nettle, alfalfa, horsetail, red clover, and red clover is also a phytoestrogen, which we will talk more about in a little while. But all of those are really highly nutritive. So you can drink them as a tea, and that can be like a natural multivitamin that your body can actually absorb better than taking a multivitamin. But if you do all those herbs in like an apple cider vinegar and put in some eggshells and let that sit for a couple of weeks, and then you have a vinegar you can use as a salad dressing that's going to be a really high calcium, high mineral vinegar. So it may seem kind of weird. You just want to wash the eggshells, get any membrane out, and let them soak in the vinegar. And then the vinegar is really absorbing that calcium. And then when you take that, your body can absorb that calcium much more than if you were to just take a calcium pill. And then you have all these herbs in there as well that are high in calcium and other minerals. So it's a great way to have a highly absorbable form that's also not dairy, because a lot of people, dairy, even though it may have a lot of calcium, it's going to create other problems.
Yeah, that's great, Rachel. And I love that that's not going to constipate people, because calcium supplements are not tolerated well. And the other thing is, a lot of people are overlooking their vitamin D level, because you really need the vitamin D to prevent osteoporosis. In our country, the vitamin D being low is usually even worse. It's usually even lower than the calcium level for people.
Definitely. I feel like people will say, oh, I eat yogurt every day, I'm doing all this dairy, like I should be good. And it's not quite that simple. I think that was the sort of mainstream message that a lot of people got, drink your milk, have your calcium, you'll be good. But yeah, the D3 is really huge, and there's a lot of deficiency in that as well.
Yeah, and my class I'm taking, we also talked about plant sources of calcium, and spinach has the oxalic acid, but a lot of the other leafy greens are much lower in it. So kale is one of the best sources of vegetable-based calcium, and you absorb the calcium better than you do from the dairy, right?
Mm-hmm. And I mean, you throw some kale in a smoothie and you're not eating kale, you know, you don't have to put a ton in, but just throw it in there.
Yeah.
And you can find ways to get it into your diet with a little creativity.
Yeah. Yeah. We have recipe ideas, so message us for those. The other thing is, things can look like menopause that are not menopause. So I'm thinking of one specific person that came in a couple months ago, and she had insulin resistance, definitely some anxiety, and hyperthyroidism. She actually had all of those. Also some food allergies. So I just want to point out that, especially things like hot flashes may not be hot flashes from menopause. They could be hot flashes from mold toxicity, which is a very different ballgame altogether. And I think that this kind of says it all, where it says every woman aged over 55 will undergo the transition. A lot of times people are coming in at age 40 or age 45. And so we really have to make sure that this is early menopause and it's not all these other things. And then, of course, exercise is helpful for the hot flashes. It actually reduces the hot flashes. It may not be what you want to do when you're having a hot flash, but it definitely reduces them. And smoking is going to make the hot flashes a lot worse. And weight gain actually is one of the things that makes the hot flashes a lot worse. I'm going to get back to the weight conversation in a minute. And then the last thing I wanted to say too is that alcohol can make the hot flashes worse, but it can also increase the breast cancer risk. So a lot of women are trying to have that glass of wine because it actually helps the hot flashes not feel as bad, but it turns out it makes them more frequent. And then they have them at night when they're sleeping and it wakes them up.
And also going to the hot flashes, the liver, that's also indicating heat in the liver. So we want to cool the liver. So alcohol is going to bring out hot energy to the liver as well. So with hot flashes, that's definitely a sign of go to those liver herbs, cool down the liver, clean the liver.
Yeah. Yeah. So I try to give people recipes for mocktails, like healthy, and something to do with kale that they can palate. So those are two important things.
And sage is really wonderful for hot flashes as well. That's a great one. Yeah, just some sage tea, or even just soaking some fresh sage leaves in lemon juice and just eating them. That's a sort of like a folk remedy for hot flashes.
There's so many different kinds of sage. Does it matter what kind? Like we have pineapple sage growing, just inside.
Yeah, I don't know about pineapple sage. Maybe I think just Salvia officinalis, like your classic garden sage.
Gotcha.
Mm-hmm.
I also mentioned here getting a thermogram because, I just want to comment briefly that mammograms really catch cancer after they've started. And thermograms are much more preventative. So now, if you're starting to do this and you're not sure which one to do, you may have to do both for a little while. However, the thermogram is going to, especially if you do it with a certified thermographer who's also a coach, and I can recommend people if you want to message me. But I had a thermogram that was pretty life-changing in terms of just showing me what I need to work on. And now I know how to prevent breast cancer. There's nothing worse than finding out when it's too late, So yeah, I just wanted to mention the thermogram. I really think insurance is going to start covering it more, but even if not, people that I know that are doing them, it costs about $200 to $250. So they're not super expensive compared to other tests.
Do people know what that is? Do you want to just
yeah.
Mammogram versus thermogram?
That's a good point. Yeah. So different shots or pictures using an infrared or a heat sensitive camera that can tell you where the most heat is. So things like cancers or infections would be much hotter than the rest of the skin. Now it's not going deep into the tissue, but if you're someone who has fibrocystic breast, if you're someone who's had dental work, if you're someone who has thyroid disease, all of these things are going to show up on the thermogram as being hotter. And the key is it symmetrical, or, is one side hotter than the other? In which case, the thermographer that I know, there's a few of them in the area, but the one that I know will do 9 different shots, and she'll include any dental work you've had. So she includes your mouth in the shot. So she's not just taking pictures of your breast, she's also doing thyroid and your mouth. So if you've had any root canals, any mercury fillings, if you have any thyroid disease, it's even better to get a thermogram just to kind of look at how everything is going. Yeah. So I wanted to comment briefly about bioidentical hormones. There's certainly, sorry, this is actually talking about something a little bit different. Let me skip past that quickly. So everyone went back and forth within the medical community for a while. Are bioidentical hormones safe or not? The bottom line is that it's an individual decision, between a clinician and a patient, and the risks have to be weighed and the benefits have to be weighed. And for some people, the risks of bioidentical hormones are very, very low, and for other people, they're very high. So it's important to kind of go through and talk this through. There's clinics where people are kind of rushing in and getting a prescription and leaving, and they're not seen for a year or two. And I wouldn't really, even though that sounds convenient, I wouldn't really recommend doing it like that, because there's any pharmaceutical, but especially something that contains hormones, there's risks. And I would say the same thing really about things like adrenal glandulars, or there's lots of hormones that people are taking that are even over the counter. DHEA is kind of an example. People come in with bags of supplements that are over the counter, and some of them actually contain hormones as well, and they don't even realize it. So I would just say, look through things carefully, and definitely have a provider that you have this relationship with, and that they're doing their reading and trying to keep up with the most recent research. And I think I mentioned it above, but there are certain types of breast cancer where if you've had it, then you should definitely not be on hormones. So yeah, and I think Rachel kind of mentioned that in the beginning. This talks a lot about some of the herbs, and here we mentioned black cohosh. Do you want to talk about some of the herbs for menopause?
Oh, for menopause, yeah. So black cohosh can definitely be helpful, particularly it can help with hot flashes, but black cohosh is a phytoestrogen. Those are the class of herbs that we look to a lot during menopause, which are herbs that are replacing the estrogen in a certain way. It's not that simple, but they're giving your body some of what it needs, which maybe we'll get into in a moment. But black cohosh is really fantastic because it is supportive during menopause. It is also great during menses because it is an antispasmodic. So if you have cramps, it can be really helpful then. And as well, it serves as a pelvic decongestant. So I don't know how much I should get into all of that right now, but it increases the circulation in the pelvic area, which sometimes some of the issues with bleeding with menstruation is that there's stagnation in the uterus. And that's when you see clotting, that's when you see sluggishness. And that's also when you see flooding, when there's sometimes flooding can really just be from a deficient place. We kind of look at people's symptom patterns, and the first thing you kind of want to decide is this a deficiency or is this an excess pattern? Sometimes they can be confusing because you look at flooding, that seems like excess. You have an excess of blood, you have an excess of estrogen perhaps, but it can also be a deficiency. Anyway, pelvic decongestants can really help if there's stagnation in the circulation of the uterus, and black cohosh is one of them.
And then do you use either of these down here, the Angelica?
Angelica sinensis is Dong Quai. Definitely that has helped. I mean, sometimes I work with women and that's all they're doing is they're just taking a simple Dong Quai tincture and they're like, wow, this changed it. Generally, I like to make a formula that will have something like either Dong Quai or black cohosh. We'll have a liver herb, maybe there'll be an adrenal herb, and it'll be a formula. But she was just taking Dong Quai, and it's a really wonderful phytoestrogen. This is interesting. Dong Quai with chamomile to reduce hot flashes and improve sleep. So chamomile is an anti-inflammatory, and then as people know, chamomile tea helps you sleep. So the combination of the two, an anti-inflammatory with a phytoestrogen, is going to be helpful for hot flashes.
Yeah.
And humulus is hops, which is what beer is made from. That is also a phytoestrogen. And that is known for helping hot flashes, especially when there's issues with sleep, because hops is helpful for sleeping.
I've noticed it's in some like sleepy time teas and things like that.
And it's very bitter, so sometimes it's hard to like have it in a tea. But if people, it's a very strong one for sleep.
Yeah. So, and I just wanted to comment here that yoga can help with hot flashes. And it doesn't have to be that crazy. I wouldn't recommend hot yoga, and I wouldn't recommend power yoga. I would recommend more of a yin yoga or gentle yoga. If you have questions about that, let me know at the end. But not too much to say other than yoga can really help. And then these are some other herbs that kind of help with some of the symptoms of menopause, but do you have other ones for menopause you wanted to talk about?
Let's see here. So yeah, the liver again, I mean, that is just something that I always come back to. And vitamin E, do you recommend that? For that's for like vaginal dryness and also for hot flashes?
Yeah, I also can check people's vitamin E levels just because it is something that's fat soluble, so we can get too high. So I do.
And for a prolapsed uterus in menopause, kava, which is the Piper anyway.
Very much easier to say.
Yeah, that helps to raise the energy. So kava is something that people take for anxiety. And so it can be good if you have mood issues with menopause, with perimenopause. Kava can be great. It's also going to move that energy upwards. So if there's any prolapse, it's going to help to just lift. And in addition, just sort of sidetracking here of prolapse, yarrow is also helpful with that. Burdock, which I mentioned before, is a liver herb. So again, there's herbs do many purposes. Just in general, treating the adrenals, which ginseng is an adrenal tonic, that can be really helpful with both PMS and with menopause and the symptoms associated with them, because it's helping to balance your adrenal hormones and tonify the adrenals in general, which is going to have an effect on the whole hormonal system. So Siberian ginseng is really great. Licorice, which you don't want to take if you have high blood pressure, but that can also be really helpful, and it's an anti-inflammatory. Yes. So I also like motherwort a lot. It's a good energetic. It's tonifying to the female reproductive system. But energetically, it's also very nurturing and holding, and it can be helpful for this transition.
That's awesome. So kind of moving on slowly to the libido. I talk to a lot of people about, are you pooping enough and are you having sex enough? And everybody's embarrassed that I'm asking them those questions, but they're important questions. So pelvic floor exercises can help if things are simply uncomfortable. With women, libido can be complicated, whereas with men, it's usually more straightforward. With women, sometimes there's a whole, psychological component, especially if something's painful. You don't want to go do it again. And sometimes you can have the urge, but then there's something stopping you. And so working through someone that you trust. I also recommend energy work for this. Or something like qigong or tai chi or yoga, moving the energy. And I think almost everyone should see a pelvic floor therapist at least once, just to kind of get assessed and see how things are. I even have men that have major pelvic floor issues. I think a lot of it is we're sitting too much. We don't walk miles and miles every day, and we don't carry stuff. And so our pelvic floor can be too loose in some places and too tight in others. And that doesn't make sex very comfortable. So I just wanted to mention that. And then this also talks about herbal medicines to help with libido, if you want to touch on those too, Rachel.
So I'm not really going to touch on, shatavari is asparagus racemosus, and that's a good one. That's a really tonifying for the female reproductive system, but it does increase libido. That and Damiana are the two herbs that I go to the most for that, to just really kind of support this juiciness and support that part of the female reproductive zone.
Yeah.
Mm-hmm.
And of course, if the estrogen's falling, addressing the estrogen's going to help, or the herbs that help the estrogens.
Definitely.
Yeah, and then also vitamin D being very low, which we've already touched on, may have something to do with vaginal atrophy. So, recently there's been a few reports where different boards are saying don't go above 4,000 IUs of vitamin D3 a day. However, many providers are using it in higher doses short term. But again, you've got to up your magnesium, and I recommend working with someone. Vitamin D is more of a hormone than it is a vitamin. So I recommend working with someone who's more comfortable with this as opposed to just taking an over-the-counter one. D3 is better absorbed when taken with K too. And so if you have a D3 that doesn't have vitamin K in it, you might want to switch. But definitely getting your level checked is really important. I already mentioned that vitamin D being low can cause osteoporosis. Another thing that can cause osteoporosis is actually having too few omega-3 fatty acids.
Mm-hmm.
So if you're not familiar, a lot of us are eating too many omega-6s and not enough omega-3s. The typical American diet has way too much vegetable oil and processed foods and not enough of the omega-3 fats. There's omega-3s in egg yolk, omega-3 in fish, omega-3 in flax, omega-3 in hemp and chia. So you don't have to eat meat to get omega-3, but definitely it's important to correct this. And you can get an omega-3, omega-6 ratio done that would help you know. You can also just kind of look at your diet and see. And I'm going to get to the phytoestrogens again in a minute, but I want to point out that 1,500 milligrams of calcium a day and 800 of vitamin D are actually the lowest recommended amount. So we really want you to get a little bit more than this in postmenopausal women. So, and women of all ages should kind of be looking at how much calcium they're getting from their food, or trying something like Rachel mentioned in terms of getting more calcium. The eggshells and the vinegar is a great idea. I just kind of put a chart of different foods that contain calcium. We already mentioned that you absorb it better from the grains than you do from the dairy. Definitely walk the stairs to keep the bones strong. There's nothing like a constant weight-bearing exercise to keep the bones strong.
Mm-hmm.
And sometimes I see it where the 60-year-old woman moves to a ranch house and she no longer has stairs, and then suddenly the bone, the density of the hip bone goes way down. So I say if you don't use it, you're going to lose it. Don't move to a ranch unless you can't walk up the stairs. And then here's where I mentioned the phytoestrogens. So, we went back and forth for a while in terms of soy. Should we recommend soy, or is soy detrimental? But it turns out that research that we now have tells us that soy foods contain phytoestrogens, and they actually probably should have named them something else because it's a little confusing for people, but they're anti-cancer. They are amazing in terms of the benefits that they provide, and especially fermented soy. Now, I'm not talking about like all the soy lecithin that's like pushed into the packaged junk, or like tofu that's overly processed, eating that 3 times a day. I'm talking about more like organic edamame, or foods that were not sprayed, that are soy based, especially like a fermented soy is very healthy.
Like tempeh is better than tofu. Tofu is very processed. Tempeh is fermented.
Yeah.
Miso, great. Another fermented soy.
Yeah.
People are really thinking, oh, soy milk, tofu, yeah, and then that will start to have an effect on the thyroid. So you have to be really careful of that. Vegetarians that have been eating so much soy for so many years, suddenly their thyroid is like, very, very much in a bad place.
Yeah.
So the key is you want fermented, you want to stay away from processed, and you don't want to eat in excess. Like a lot of vegetarian diets are really emphasizing soy, and then, now there's been sort of a shift of like, eat more meat. It's like what it used to be, don't eat meat, and now eat meat, eat less soy. So basically you want to get the right kind of soy, definitely organic, non-GMO, and you also don't want to overdo it.
Yep. And I have a little bit more about food at the bottom, so let me go through a little bit more of this. Acupuncture can help a lot with menopause. I don't think I need to go on about that. This is like the 4th time the word yoga has been has come up for menopause. So here I just wanted to mention, this talks about using different things to ensure a smooth transition, and some of this is actually recapping. However, we didn't talk about vitex yet. Do you want to talk about that?
So vitex is, it encourages the production of progesterone. It is often also indicated in menopause as well. So some people, depending on what's going on with them, you want to go Donquai, some people vitex. But it increases luteinizing hormone, and it increases progesterone. Vitex is really fantastic. You do need to take it for a few months to see an effect. And ideally, you're taking it in the morning as soon as you wake up at the same time every day. However, again, Vitex has become this one where it's like, oh, let me just take Vitex. And sometimes, okay, that will work. But when you're talking about hormones, you really want to consult a professional, because, you know, maybe you're taking your Vitex, but then you're taking something else that you don't even know. And then you have no idea what is affecting what. Vitex can be really helpful with there's a lot of different ways to use it. You can also use it, you can use it for your whole cycle. You can use it just for the follicular stage, just for the luteal phase, depending on what you're using it for. It can be really helpful if women get cold sores as a PMS symptom, to take Vitex right before you get your period, like a week before. So there's a lot of different ways to take it. Vitex is the Latin name. The common name for it is chaste tree berry, because when monks would take it to lower their libido, because if men take Vitex, it lowers that. So hence chaste tree berry. Yeah. Do you have anything else to say about Vitex?
No, I have an antidote, but I don't want to run out of time. So let me go down and then we'll come back to it. In terms of preventing, I mentioned the osteoporosis risk as your estrogen drops, but in terms of preventing heart attack, one of the best antioxidants is CoQ10. You can take this. You can also get your level checked to make sure you're not taking too much. It's not a cheap supplement, so I recommend people only take it if they really need it, especially someone that's already had a heart attack. That would be a very specific situation. But other two major antioxidants are glutathione and vitamin C. We make glutathione using different amino acids, and we also can take in a lot of vitamin C through our diet. But both of those can prevent heart attack. And then I wanted to mention, in terms of preventing heart disease, reducing our stress and how often during the day we can take a deep breath can actually be one of the biggest things that prevents us from having a heart attack. Now, that might sound crazy, but I promise there's research to back this up. Sometimes when we're reaching for the caffeine, it's because we need more sleep, but sometimes it's also that we've gotten used to that sort of intense feeling. And if we can actually convince ourselves to try less caffeine or to quit sugar, that will definitely prevent the inflammation that leads to cardiac disease. So, obviously this is its own workshop in and of itself, but I just wanted to mention there's lots of things you can do to prevent heart disease as your estrogen falls.
And as well, there's herbs, there's cardiovascular tonics, and a lot of those herbs, again, they're kind of repeats. Motherwort, which I talked about before as a tonic for the, female reproductive, is also a heart tonic. So again, we're touching two places at once. Bitters can be helpful, and that's liver herbs. Most liver herbs are bitter. So there's herbs that you can incorporate into your routine that are also going to help and be cardiovascular tonics.
Yeah, I love it. We have to do another talk on that. So I want to move on to PCOS. And if you guys have to drop off, let me just see if anybody posted any. Can you see the chat, Rachel? Did anybody post any questions?
I don't think so. No.
Okay. If you guys need to drop off, feel free. We're going to record it. I'm recording it and I'll send you the rest. I want to talk about PCOS. So if you've never heard of it, it stands for polycystic ovarian syndrome. Special interest to me because I was diagnosed with this 20 years ago. And when I was diagnosed, the doctor told me that he was just going to have to do surgery and take my ovaries out and there was no other option. And I was very stubborn and I told him no. and went and started learning more about what causes it. And I feel like that was sort of my journey into functional medicine was this person wants to do surgery that's essentially going to, even though I don't want kids now, it's going to make it so I can never have kids. Let me go learn about what caused it instead of just taking my ovaries out. Because obviously I needed them to make my estrogen and progesterone. So I would have had a whole lot of other problems if he just took them out. But I was having like really severe cysts, like so big, they were 8 centimeters. They were really big and really painful. And what I now understand is that it wasn't just diet. It was also stress. It was also like that as a kid, I'd had chronic insomnia. It was probably some pollutants I'd been exposed to over and over, some heavy metals. But I'm bringing it up and telling you my story because I healed myself just through stress reduction and food, and also then later getting control of my thyroid, and I'll talk about that in a minute. But a lot of times people are told they have PCOS and they think they have it forever. And so I just wanted people to know that I'm proof that you don't have to have it forever. You can certainly have a healthy reproductive life and a healthy cycle and healthy ovaries without getting cysts every month. But basically people with PCOS often get a cyst instead of actually having the egg be released every month. They often have a cyst. Sometimes when we do an ultrasound, we can see a lot of little cysts because they last for a while. It's called a string of pearls because it looks like pearls on the ultrasound. Not always, but a lot of people that get PCOS are also overweight and have some insulin resistance. And so this is what the hormones look like. So your luteinizing hormone stays at the same level instead of getting a nice peak, and your FSH stays at the same level. So we can do blood work to confirm. And let me go down here to show you. This I just put in because I wanted to mention that insulin resistance, obesity, abnormal lipid metabolism, and extra androgens, these can all lead to PCOS. I had a parent come in once and bring a daughter and say, I think she has PCOS because she's taking math class with 6 guys and she's the only woman in the class. I don't think that's necessarily the reason in terms of this is actually you're making more androgens or you are taking in more androgens. But there's kind of like studies out there that show mixed results about, do you actually get on the same cycle as people in the same room as you or people you're living with and things like that. Just an aside. So, but risk factors for PCOS are basically that you do have insulin resistance or you're just eating the standard American diet. I mean, a lot of people are at risk for getting this. My diet when I was diagnosed was probably carbs, corn, sugar, soda, all the things were made up most of my diet. And we now know that high fructose corn syrup, sugar intake, and processed foods can cause PCOS. And then these all also give the liver a healthier load, which we've already talked about how important the liver is to have a natural cycle. But those 2 hormones that you need to surge, they don't surge. They're not cycled out every month, and therefore you just have stagnation, like Rachel's already mentioned. And then I wanted to mention that the thyroid can actually, if you have low thyroid hormone or Hashimoto's, which is often low thyroid hormone, you can actually have an increased prolactin from the brain, that part of the brain called the pituitary, and this causes the cysts in the ovaries. So if you have Hashimoto's or a low thyroid, it's really important to get checked for PCOS, and the opposite is true too. And sometimes the causes are very similar, so we can kind of back up and figure out what caused it. It certainly makes more sense to me to figure out what caused both than to just try to treat each of them separately, right? And then some people, even though their androgens are high or their testosterone is high with PCOS, it can actually cause their sex drive to be low. So that's a little confusing for people. But also, oftentimes people also often get male pattern hair growth, and that makes them feel self-conscious. And so sometimes their sex drive is lower also because they're more self-conscious about that. Did you have anything that you wanted to add about PCOS as I just kind of
well, there's great herbs that can be really helpful for that. The herbs can regulate luteinizing hormone, peony, licorice, vitex would be called for here. And then the excess androgens can be helpfully, a lot of that male pattern hair growth by taking saw palmetto, which is known for helping to tonify the male prostate. And older men take that a lot. That's kind of like its namesake, but it's really helpful here when there's excess androgens for women to take saw palmetto. And also working on the glucose levels, the insulin, like eating more protein. Protein is really important here. You want to eat less carbs and more protein. And also cysts, low dairy, because that can really create a lot of stagnation. So when you have symptoms like cysts that fit into a bigger picture, whether it's PCOS or fibroids, and that is suggestive of stagnation. So dairy can be really stagnating. So you want to be careful with that.
Yeah, that's a good point. I didn't mention that a lot of people I see with both the low thyroid and the PCOS have a dairy allergy or sensitivity. To me, it's the same thing.
Mm-hmm.
Yeah, and the thing that I did to really fix, over about 10 years to fix my ovaries was how many greens or vegetables could I eat in a day and how much protein could I eat? And if you just kind of just challenge yourself. So I didn't feel restricted because I didn't actually say no to the other stuff. I just tried to see how much of that stuff I could eat. And at the end of the day, I was actually pretty full of veggies and protein. And that's what I put. Let me skip ahead to this one. So yeah, this paragraph here, it's recommended that we get 6 to 9 servings per day of fruits and vegetables, 25 grams of fiber, which is way more than most of us are getting. And the general rule is eat food, real food, not too much, mostly vegetables. So it's not that we have to subscribe to a specific diet. I think it's more important that we pick things that are colorful, that we like to eat, find vegetables that you actually really like to eat, and then don't worry as much about the restriction, because I think the way our minds work, as soon as we start to try to restrict stuff, then we only think about those. Mm-hmm. And to that, I want to add people that are on the healthier end of a BMI, their bones are stronger and their mental health is healthier. So I get more concerned about people that are on the lower end in terms of a healthy BMI, because I'm more concerned that they're kind of slipping into a more controlled eating disorder. And so I'm much happier when people's BMI is a little bit higher, provided they're not obese, because the studies show that those are the healthier people. So it seems a little counterintuitive, but a lot of times people come in and they want to lose 5 pounds. And to that, I say the stress of needing to lose 5 pounds is way worse for you than the 5 pounds. If you can, just let it go. And I also listed some foods here that can balance your hormones. And I know you said the asparagus herb. That's interesting that it has, what was that herb that sounded like asparagus?
Oh, yeah. Shatavari. Yeah. Mm-hmm.
Yeah. And I know my mentor, Dr. Sleepy, always talks about Brussels sprouts and asparagus, and they're great for helping with the liver process your hormones and just kind of cleaning out the liver stagnation too.
Yeah, all of the cruciferous vegetables are definitely good for that.
Yeah. So, I mentioned a couple more things here about sleep and about stress. I guess the last thing I'll say, and then I'll let Rachel close it out, is just that the MTHFR mutation is kind of a buzz topic here lately. It definitely affects PMS, and PMDD is premenstrual dysphoric disorder, which is like, people that really can't go to work before their period. They're like so depressed. And what I find is that different variations of this MTHFR actually make it harder for you to detox. So especially if you're exposed to plastics, if you're exposed to heavy metals, if there's just a lot of garbage in your environment, which may not be your fault at all, then it's going to be a lot harder for your liver to recycle your hormones every month. So I don't know that the MTHFR mutation in and of itself makes PMS worse directly, but it certainly does it indirectly by making it a lot harder for you to detox. Yeah, and I kind of skipped a little bit of the, let's see, sleep. I have a sleep hygiene handout. Sleep is kind of its own workshop we could do. We could also do another workshop just on the adaptogens again and the adrenal glands. But suffice to say, I think what we gave you all is a good basis for the hormones. We didn't talk too much about fibroids. And I think that Rachel can help, and I can help if you want to come talk to us more if you've got fibroids. Anything that you wanted to mention about fibroids or anything else that I didn't say?
No. I mean, I could get into fibroids, but maybe for lack of time, I won't. But I feel like the two things I have to emphasize are liver support and adrenal support, because stress and an overburdened liver cause a lot of problems in the body.
Yeah.
And herbs can be really helpful with addressing those parts.
Yeah, and I think I would mention, just look at your foods. And actually, here's where I mentioned, again, the xenoestrogens and the plastics. Endocrine disruptors are present in all baked and processed packaged foods. Even something that says the Harris Teeter Bakery, it still has endocrine disruptors. So what does that mean? It means you think you're eating this like freshly baked bread or freshly baked cake, but they've added a bunch of stuff in it to make sure it doesn't go bad. So if you're gonna eat things like cakes or breads or cookies often, then make them yourself so that they're much healthier and better for your hormones. And then the second thing that I think is my take-home point is just to take a look at your stress. People often come and ask me, like, how come I have this PMS or this fatigue or these issues? But the truth is we're overscheduled. And so my trick for that personally, because I'm so busy, is I really schedule my downtime, which sounds silly, but if I don't schedule my downtime, then I'm going to schedule over it, right?
Absolutely. I do that too. I think that's really important, because people are so into scheduling, but we don't schedule our downtime. So then you feel that, and then suddenly you don't have any downtime. So it is really important to do different practices like that to help manage stress, because I think that sometimes people feel like, well, yeah, I have stress, but like I'm busy, I have kids, I have a job, blah, blah, blah. Like I can't do anything about it. And if you just incorporate little things here, like schedule some time, in the day, take a minute twice a day to really stop what you're doing and breathe. That seems like, well, like, how's that really going to help me? Well, it is going to help you. And it only takes a minute. So trying to incorporate these little practices that maybe aren't taking the load of your life off, but they are helping to lighten it for your entire self, especially if you do practices like that consistently. Just creating a little bit of space for yourself.
Yeah, I love it. Okay, I'm happy to email this out. I'm also happy to send out, I put a question here at the end, energy work, how is it valuable? I think things like Reiki and hypnosis, and Carla does the access bars, I think all of them are very valuable, because one thing we didn't really get to that could also be its own workshop is trauma and sexual abuse and incest, and how this has affected our cycles. I talk to almost no one who has had zero trauma, and the incidence of sexual abuse in women is so high. So if that resonates for you, think about doing some energy work. Think about doing something a little bit outside the box, or something like EMDR even. But consider other modalities that would actually reach some of the subconscious, because when you've had trauma, there's definitely a deep scarring there, and that can certainly affect the hormones deeply. So, and this is kind of easier to explain than it is to experience, but I definitely recommend people try some energy work. If it seems kind of frivolous and expensive, ask for it as like a gift, to try it. So yeah, but I'm happy to hand out my email out my PDF, or give out there was a couple of videos that I recommend people watch. So just shoot me an email and let me know. Rachel, is there anything else you wanted to add?
No, I mean, I work with Kate, and if you're interested in herbs, you can contact me, or she can send you my way. And I have herbs available for people, tinctures and teas. Mm-hmm.
Great. I appreciate your time tonight. And if you're watching this on the recording, thank you. Thank you for those of you that are still here live, and we will talk to you soon. Have a wonderful night. Thanks, Rachel.